So I'd now like to welcome up Francesc March, who is an ophthalmologist at Otago University and has been internationally trained. Specialises in retinal disease, glaucoma, and complex cataracts, with extensive fellowship training, active research, and publications, and a strong interest in inter-RAI research on vision, hearing, and how they impact the quality of life in older adults. And today he will be presenting on the epidemiology of vision and hearing impairment in older community-dwelling adults in New Zealand.
Thank you so much. Thank you. So the excuse is we'll talk about the importance of vision and hearing in older people, which is the big topic. The excuse, we will talk about research with Hamish. So thank you, Hamish. Thank you, Ulrich, because you have been helping a lot. And if you can put the presentation, it would be highly appreciated. So do we have to do a presentation talking about how important is vision and hearing? Yes, you will hear how important it is. Otherwise, you will listen to it. No, it's not the presentation. So if you could help me find it, would be great. Oh, yes, here we go. So if you have any interest, please get in contact with me. Unfortunately, I will have to leave in here. I will have to do a session. I'll go back. So please get in contact. And if you have interest for the more formal presentation, look that online because it's a very cool publication we did last year. Yeah, so I will try to explain on the more fun part, so in this way everybody's awake, but look for the publication because it's rather interesting. So I'm ophthalmologist, I do surgery on the eyes, I do as well aerospace research. This is me, but it does not look my face. I also, I'm taking care about penguins, and one of the things I think is more important is explaining to the public how important is vision and hearing. Yes? Do you know somebody has changed their life after doing cataract surgery? I see that every single day. It's amazing. Yeah, so I do ophthalmology because my grandma, she was 91, almost blind. At 91, 20 years ago, a lot of people think it's not worth it. With the cataract surgery, both eyes, she lived 100 years. 9 years were a gift. She could be able to see thanks to that. So what I want to help more people. And the way to help more people is explain how important is that. And for that, inter-RAI is amazing. So when I was listening about inter-RAI, thanks to the work of Gary and Hamish, it was like, wow, that's amazing. I want to be involved. And then I was looking at this is a subjective vision and hearing assessment. So they asked people, how good is the vision and hearing? Yes, it's a subjective assessment, but I think it's rather easy. So we can ask people, how is your vision, how is your hearing, and then think how we can improve their life and the implications of that. So it's easy. It's easy. If you say like an objective way, we have ways to make it something objective, because always some people can say like, how is your hearing? What? So you always think about how good is going to be the information, but at least it's very practical. So how important is vision? How important is hearing? It's critical, because when the vision is not good, people is dependent. People can sometimes not feel for themselves. People tend to be less happy, and we know that we have more dementia. So it's critical. We know, for example, more loneliness. Loneliness with people has worse vision and worse hearing. We'll take notes of that. So we know it's important numbers, yes, and it affects all health. It affects more mortality. That's dependence, almost 3 times more dependence because the vision is not good. And we can look for good solutions for improving vision. I got the previous conversation, and we were talking like, you would have a treatment to stop dementia that would cost $4,000. You would only take it one, and the side effect would be that your vision would be better. Would be amazing. We know that doing cataract surgery can avoid dementia. So today, what I'm trying to explain is how important is that. We will talk about the epidemiology study that we did. How often is people using visual aids, hearing aids, and how often do we do examinations? We also will try to explain about health correlations. How important is that in daily life? So I'm just going to explain briefly what we did. Go into the article is more interesting. So what we try to do is with the comparisons in home care with residential care, and we assess how often people go to check their hearing and how often they have the aids. And as well, we can identify how often we have vision and hearing problems. We found that people that complain about hearing problems is around 20%. So 1 in 5 people have big hearing problems. Visual problems, 1 in 10. We're talking about moderate and deep problems. People that maybe have some sort of problems, 1 in 5, 1 in 3, probably would make a difference if we do something at these stages. But the people are struggling is 1 in 5, 1 in 10, which is remarkable, is important. And that's one thing that is very important is how often people do the examinations. Because people that are in residential care, sometimes they are are more dependent. So we need more the help and the support to make sure that everything is fine. The other important part as well is the aids. So we know that a lot of people here are wearing glasses. Yes, people in residential cares, home care, 70 is like you would imagine 3 over 4, they have glasses. But 1 in 4 looks like they probably has no glasses. So that's a problem. If we're trying to read, we're trying to do things in daily life. Hearing, 1 in 5. When we know that this hearing problem is something common. These is things to think about. And if you go to look in more detail, please look at the article. Bill, I hope you read that. So, easy take-home message in the care that we offer to patients, like when is the last time, how is your vision, how is your hearing? And when is the last time that we check that? This is maybe the most important presentation. This is something topical. That's something that we can make a difference in somebody else's life. How this is important? We did an analysis relating the vision loss with health outcomes. This information is gold. Why? Because we can explain when the patients have worse vision, have more dementia. You can explain how important is improving vision or stop the deterioration. You can see the worse vision increases the risk 1.66 times to have more dementia. This affects especially Pacifica and Maori. That's a big issue. We know, of course, that we have problems with communications. We can understand why people that has worse vision will have more problems. We know that 80% of the information is the things that we see. When we have worse vision, we have less connection with the environment. We are more dependent. We are more dependent. And we die younger. That's why it's critical to preserve vision. Completely worth it. These presentations are important to me. And just to try to talk more about accessible healthcare, I will try to present a little bit the outcomes when we are doing a little bit of a further assessment about how common are the visual problems. So similar data, we analyze more people. The people who have more problems is 10%. People have mild problems, 1 in 5, 20%. And we see that this is rather common in all the different ethnicities. But one of the bigger problems, and we can see here, is that the vision aids changes a lot among different ethnicities. Yeah, so you can see Pacifica lower, almost in some analysis half of New Zealand European. We're talking about difference between 80 to 40%. Half of it. And part of it is related to equities, payment, all of these type of things. On hearing is less common. We can see that too. But the main one is vision, because it's more common here. How often people go and check their eyes? How often do people check their ears? Recommendation should have to be once a year. Reality is around 50%. We are very far away where we should have to go. And we have checked as well was Maori and Pacifica. All of this information is important because if we want to change the way we treat all the people, if we want to make a difference, that's a very easy way to address that. I'm looking to hear more about the research of Etu. Etu, I'm looking to hear more about you next year. Yes, every year I remind it to you, but next year we have to talk about these things. Yes, so vision aids are more common than hearing aids. we know that they're very important. We know there's a lot of difference and gaps on the way that the people have access to that. And definitely we have to do more. This is a publication. And I think maybe I will leave it here so in this way everybody is awake. Xavier, thank you so much for coming. Xavier introduced me to interRAI, so thanks, Xavier. Thanks to you, I'm here, and I would like to appreciate that. Gary helped me, and with Gary, we did a very interesting publication explaining that when we do cataract surgery, we avoid dementia, 30%. Imagine the cost of a cataract surgery, $4,000 compared to somebody with dementia, $50,000 a year. How cheap? How amazing. That's a good word. So if we talk a medication, imagine a drug that could stop dementia 30% would cost $4,000 only once and will last all your life. And the side effects improve your vision. That's crazy. Yeah, so imagine now try to sell me a drug of Alzheimer, of dementia, cheaper than that, better than that. I'm waiting. So, you know, I'm very, very happy to be here with this group of very smart people, all of you. So it's my pleasure. I will be around. I have to go to a meeting and I will go back. But, you know, please come and talk with me because I'm very interested to talk about the importance of vision and hearing. And we would like to keep working together, especially with Etu, especially with Gary, especially with Xavier, especially with Hamish, because there's a lot of things that we can make a big difference, explaining the importance of that. Thank you, Anna.
Thank you. You've still got 9 minutes left. So you're here. Lord. That means 9 minutes worth of questioning now.
Oh, sorry. So I got nervous and I began to talk too much. And I didn't want to make it too boring for all of you. So
I think we can agree it was an entertaining presentation.
Thank you so much. We can go with a lot of details of the numbers, but I think that here as well is explained what's behind the numbers. And this is people's lives definitely change. And that's something that we see every single day, or at least I see every single day with my patients. We do cataract surgery. After the cataract surgery, patients read books. Patients never have been reading for years. After we do the cataract surgery, patients are independent, walk, do a lot of different things, are able to drive. It's a life-changing situation. So what I want to explain is how important is that? Because it definitely can make a difference. But I need your help. I need your help asking, how is your vision? How is your hearing? Because definitely something critical, and we can explain how important is that. We can explain that in a lot of research overseas, but we can explain that as well, how important it is in New Zealand, for Pacifica, for Maori, for everyone. So think when you arrive home, with your parents, with your grandparents, because definitely can make a difference. I can give silence for 5 minutes, or so when I get nervous, I talk too fast.
Ask questions from the floor and from online. Any questions, anyone? I've got a quick question. Oh, you got you too. Hang on, I'm bringing you the mic so that people online can hear too.
Sorry, Eto, I put on your spot. Sorry, Eto, I put you in the spot because I care. Yeah, you are amazing. So that's only for that.
No, just the question of how your prevalence rates compare to like national data not using interRAI.
That's a big question. The problem that we have in New Zealand, we don't have a lot of national data. Yeah, so I think that the fact that we publish that with Hamish, I think that's one of the best data available that we have. The fact that we did an analysis for 2 years and then we compared to another one of, if I say all right, 6 years and we got the same data, I think it's rather consistent. And I think international can be rather similar. We did some comparisons with the database from Canada, and more or less the numbers are very similar. We know that the quality of data is subjective, so it's not objective, but if we would have a little bit of funding, we could be able to translate the subjective to something objective.
Yeah, the New Zealand Health Survey asks a self-report question.
Mm-hmm.
So you could potentially compare.
Yes. We also know, that's a very good point, Etu, and that's Esmeralda, that I think you know, that she's working on that, and we want to do something together. The interesting part is in New Zealand, to receive public funded cataract surgery, you have to correlate how is the quality of life with something objective. So the idea is if we could get maybe 20, 30 grand, we will be able to translate the subjective thing to something objective. Hamish has a question. So Etu, if you have any other question, please let me know. Thank you, Etu.
Thanks, Francesc. I think it's a really good example of how interRAI, when doing the screening questions, can identify problems that often aren't picked up in the health system. I guess I've got two questions, one for you and just to give you a break, one for the assessors who are here. But first of all, how often is this, instead of needing cataract surgery, is the person just having a visual acuity problem and not wearing or not having glasses? That's point one. And then point two for the assessors, they're collecting so much interRAI information. How much of, when the people are answering they have vision problems, how much are they referring them on to optometrists or something for review?
These are very good points. So we know that cataract is a situation will get worse when we get older. Yes, at 70, we have almost 70% of the people has cataract that are visually significant. Yes, at 90, it's almost 90%. So if it's so common that the most likely situation is the patient will have cataract, but we have to think about that. Cataract is a situation that we can solve doing a surgery, and we only have to do it once. So it's very efficient and rather cheap.
Any response from an assessor in the room to Hamish's additional question?
I'm not quite an assessor, but I have a whole team of assessors. And I think we do refer people and suggest that they get referrals. One of the biggest challenges is that usually a referral from a needs assessment service is not acceptable by the clinical services. They want it to come from a doctor. So we're dependent on saying to the doctor, we have identified this issue, and then the doctor doing that referral.
I agree with you. That's one of the issues I can see and the pathway. I know that patients are entitled to go and pay for the optometrist, that they can do some of the assessment, but the problem that is in there is that not everybody has the money. And, you know, the discussion I got with especially Pacifica community is that there's a big problem, and also can explain why a lot of people don't do the examinations and why some people do the examinations and don't get the glasses, because they're very expensive. But at least we can make a good point requesting more funding for all of these things. Is a fact.
Thank you. There were no questions online. I've just got a quick one. With the paper around the association between dementia and cataract surgery and improvement, did you look at the confounders? I'm assuming that, this is my assumption, that people that access cataract surgery are more likely to access some of the other protective factors through their lifetime in terms of dementia prevention.
Perfect. That's a good point. I will explain a little bit briefly the evidence. So this last year was the first time the Lancet dementia assessment included vision loss, like a clear explanation for dementia, which makes sense because 80% of the information comes from the eyes. We're living in a digital society with everybody spends time on screens, on Netflix, on internet, and sometimes we have to talk with people. But mostly, everything, all the information comes from the eyes. That's one point. Second point, the research I'm making reference is a publication, if I say correctly, in 2024 that was from States, and they did a retrospective analysis, and they found that it was around 30% increase of dementia. This could be one of the confounding factors, but they were doing a lot of different stratifications to try to reduce this assumption. But definitely we think that vision is critical, and you can see that in daily practice. So it's always a challenge is how we can try to explain a story of somebody individual, or to explain a story to all of us that can help all the community when we have no money. So interRAI is a great platform to do that, and I'm very pleased to be here with you.
Great. Thank you very much.
Thank you.
Quick round of applause. Thank you.